So I definitely said that you can usually turn things around, even when it comes to autoimmune diseases.
I guess this is a good time to segue into a bit more related to gut health. One thing that I guess we share in common is a lot of people seek us out for gut health protocols, largely lifestyle interventions, diet, exercise, sometimes supplementation. And it's common to have people come to us with what's known to the layman as histamine sensitivity or histamine insensitivity. They have an intolerance to histamine. They can't have high histamine foods like leftovers. They might have mast cell hyperplasia. What's the deal with this term, and how did it all of a sudden become so common?
I think it's become really common within the last 5 years, I'd say. More common within the last 3 years, where it's being popularized. Mast cell syndrome is the terminology for it. And I'm not sold on it. On paper and in practice and biofeedback wise, I would have mast cell syndrome. However, I also had gut dysbiosis or poor microbiome and bacteria in the gut for almost 10 years. And that leads to histamine issues.
That is a very good term. That leads to histamine issues. So a lot of conditions can be primary or secondary, and mast cell syndrome is a real phenomenon, and treating it. Yeah. So if you have like a cookie cutter protocol that gives everybody DAO, for example, or quercetin or cromolyn, there's a whole bunch of different protocols, but it does treat the symptom and it does work. And it is real. So those symptoms are not made up in your head, right. But it's kind of like saying, all these individuals have, let's call it beta cell syndrome. That beta cell is hyperactive and the insulin's too high. So you treat with things like berberine and metformin that make insulin go down. So is that beta cell syndrome, or is that largely secondary to caloric excess and genetic predisposition and lack of exercise?
Yeah, in secondary for sure. Like almost every single time it's secondary. There are, on paper, there's very low genetic components to it that they've been able to find where there may be some type of family passed down on mast cell syndrome. However, are you looking at the environment that these people are growing up in? Maybe they have toxic mold in their environment when they're kids. Something as simple as that. When you're in that environment, you better believe you're going to have histamine issues. You're going to have issues breathing. I live in Georgia. So in Georgia, I was having to take Zyrtec twice a day. And that probably didn't help my DAO. So DAO is the enzyme in the kidney that's produced to help to get rid of histamines. So a lot of the treatment that you would do is a high amount of DAO to start pushing out the histamines. And again, it does work it works acutely, but not functionally, where it's going to address that underlying issue the majority of the times.
Yeah, which is what functional medicine is supposed to do, is to address the root cause, not the secondary cause. That's one of the ironic things, and it's one of the difficult things about being a functional medicine provider, being in the functional health space for many years now. I sympathize with people who seek out functional medicine because there is a selection bias. If there's somebody and the traditional healthcare system hasn't worked for them, then they are more likely to have zebras. So zebras are things that are uncommon. Horses are things that are common in medicine. A lot of med students like to chase the zebras. And a primary mast cell hyperplasia would be a bit of a zebra. Even things like a heavy metal toxicity or a tick-borne infection, I certainly see them, and I certainly have patients that have had these, but they're a bit more of a zebra. Symptoms are, for example, if let's say there's a patient that has hypothyroidism, it's probably more related to just idiopathic hypothyroidism or Hashimoto's than it is secondary to some sort of poisoning or toxicity.
Absolutely. And hypothyroidism, especially within women, and unfortunately, this is one thing that I see all too often, is women in their teens actually even being put on thyroid medication sometimes, instead of a natural glandular or something like that, and being told, hey, you need to start doing meditation or going out for walks, and giving some people coping tools to help with putting them back into a parasympathetic state,
Thyroid medicine is not necessarily a lifetime medication. If you have a TSH starting under 10, then there's a pretty good chance that you could get off. Not 100% chance, and this is not your own individual medical advice, but just as a rule of thumb to help with some actionable takeaways. Even if your TSH is a touch over 10, if you're in the postpartum state, if you had just delivered a baby, then there's also a chance that you could get off. But talk to your own doctor about all that. So I think that's a good summary of all that.
Yeah, I had a woman that actually had a 25 TSH and completely on the natural side of it, worked with coping tools, reducing inflammation. It was actually hormone dysfunction as well. It looked like Graves' disease on paper, and then it looked like her thyroid wasn't functioning all the way back online and optimally again within about a 2-3 month span of time. So I definitely said that you can usually turn things around, even when it comes to autoimmune diseases.
I think that's a great summary.